Hello, everyone. We're going to start in about 1 minute. Well, good morning, good afternoon. Welcome. Welcome to our webinar entitled The Power of Co-Design in Research, How Parent Partnership Supports Practice Transformation. We're delighted you're joining us today for an important conversation about how we're creating authentic partnerships with parents and the intentional power of co-design in our efforts for practice transformation in early childhood. It is a core value of our work of Nurture Connection. You're going to hear today about the conversation of emphasizing what we call living room language. That is non-jargony, everyday language of families that may be occurring between friends, families, and neighborhoods, and how that language is, shall we say, like kitchen table conversations. Living room language is amenable for all. Specifically today, we'll learn from each other, from researchers, practitioners, and parents who work together to develop Reachana Reed's recent Parent-Caregiver-Clinician Relationship Survey, a validated assessment tool for assessing the parent-clinician relationship during routine pediatric primary care. My name is Dr. David Willis. I'm founder and director of Nurture Connection, a national network and field catalyst promoting early relational health. I imagine that most of you are familiar with early relational health, but put it simply, early relational health is that state of emotional well-being that grows from positive connections between babies and their parents, caregivers, and surrounding community. Nurture Connection envisions a future where every family enjoys the benefits of strong, positive, and nurturing relationships. We do this by engaging a variety of voices and expertise, from parents and caregivers to doctors and doulas to policymakers and researchers, and today for engaging all of you. Today's gathering is just another example of how Nurture Connection's committed to bringing information to all of you across our network about the importance of supporting relational activities to advance for the flourishing of children, families, and communities through the power of connection and belonging. You can learn a lot more about our Nurture Connection work at our website that I believe is in the chat. And please do sign up for our newsletter. Well, you're going to hear from a variety of perspectives today. And I'm delighted for my colleagues to be with us. And all of these are my dear friends that I've known, and I'm delighted for them to be with us today. Dr. Nikki Shearman, who serves as the Chief of Research and Innovation at Reachana Reed, Dr. Dani Dumitriu, pediatrician researcher and associate professor of pediatrics at Columbia, where she serves as inaugural director of the Center of Relational Health as the principal investigator of the Developmental Origins of Resilience Lab. And Desiree Smalls, a parent leader who's involved in this research and design and the implementation of the Reachana Reed survey. And Nicole Lovelace, also a parent leader who is a member of our Nurture Connections Family Network Collaborative and one of our parent experts on our Nurture Connection Steering Committee. And as a reminder for all of you attending, feel free to utilize the chat for communicating with us and others, but also to add Q&As to the Q&A button that's also within the Zoom framework. So I'm just delighted that here with me is Nicole Lovelace, who'll be moderating today's webinar. Nicole, can I turn to you to get us started?
Yes, thank you, David. Thank you for that. Good afternoon, everyone. And thank you for showing up. I'm super excited and nervous to be presenting to all of you. And so I'm a stay-at-home mom, and it's just super exciting that I get to speak to all of you and to, connect with everybody. And I wanted to let everyone, the whole purpose of the work of doing this is to let everyone know that you're not alone, and that we're right here with you, serving as leaders, pediatricians, parent leaders, everything in between that takes care of a family. We are right here with you. So my next question is going to be to David. And so I guess what it is how do we get here?
It's a great question, Nicole. And yeah, thank you for reminding all people in our network here about we partner with families and we are there with them. So the question that you raised for us is how have we got here to have this conversation? Well, as you know, I've been a longstanding champion for advancing early relational health as a paradigm change in child health care and early childhood systems to elevate that focus on these foundational relational experiences that drive human development that we call early relational health. All outcomes of child health, development, and well-being are an outcome of these foundational early relational experiences and the context which surround loving relationships with families. From my 35 years as a clinician in developmental behavioral pediatrics in Oregon, I had the amazing experience of partnering with so many families who care deeply and lovingly of their dear children. And it left me with a passion and an unfaltering curiosity of the beauty and the power of parent-child interactions. That is an ability to really witness in our partnership with families the reality of early relational health in the moment and how that creates opportunities for all of us in those roles to build on those moments with families. Then when I was able to come to CSSP to really explore advancing early relational health, we were establishing a center for exploring the transformational power of the concepts of early relational health. I had a chance to enthusiastically share my experience for advancing early relational health, the power of observing parent-child relationships, bringing forth some videos that represented that kind of view. And I had this amazing moment on what I consider a very fateful day, where one of the team members at CSSP, who's gone on to be a great dear colleague of mine, said after my presentation, "Oh, good, another way that families can fail." That was startling. And it was a reminder about really being careful, mindful, and intentional about engaging with families to learn and listen about their experiences along this journey about early relational health and the sectors, especially child health sectors and communities that touch with them. I had been inspired too, Nicole, about CSSP's white paper called the Parent Manifesto. And within that were messages from parent leaders that had put together the manifesto of how to partner with families. And that is nothing about us without us. That has come deep into my soul and has become visible a part of our Nurture Connection view. From that moment, we began a journey of listening and learning from families. We had the opportunity of some funding that came from some colleagues in Portland to really study the perspectives of families about early relational health within first health settings. What ended up being generating a paper that's called My Baby, My Doctor, and Me with my colleagues at Portland State University and the researcher Beth Green. Her teams actually created parent-led focus groups with rural parents, Hispanic families, and Black families. And during these focus group dialogues led by other parents, they were asked to talk about the following topics: what early parent-infant relationships mean to them, and how positive relationships can be established, how parents go on for support of themselves and their babies, what their experiences with and feelings about the role of the healthcare provider in supporting their early foundational relationships, and their ideas and recommendations about how healthcare providers could best support families in developing those strong relationships. Their focus group activities, and then codified and documented in their report, found the following key findings from parents. Of course, parents value strong relationships with their children who they love and adore and want the best for. Families also communicated that emotional support is extremely important to them, and they most often find that with their trusted friends and families. They also commented, as parents, they often do experience racism, classism, and judgment in their relationships with medical providers and those medical homes. And they often spoke about not being heard or worse, judged. And when they asked about the role of medical providers to support early relational health, there was a lot of uncertainty. Some stated reservations, but a significant number of families expressed a desire and a hope that their healthcare provider could be supportive and so committed. Hearing that was striking because knowing of my colleagues in public health and in pediatrics and in clinical care longing to be meaningful and valuable in their roles with families, and to hearing families similarly wishing that their healthcare providers could be supportive and committed, generated an opportunity that we've really galvanized in our Nurture Connection work. This is the foundation of our core learning around this work. It galvanized our thinking and really brought forth the importance of creating structures and opportunities for engaging in co-development and guidance with parents. Nurture Connection created a parent advisory group that helps to co-develop and guide us and partner with us in all of our work. We now call that effort the Family Network Collaborative, or the FNC. All of this work has really come forth in terms of partnering with families. So Nicole, that's some of the ways that we've gotten here, the journey that we've come that really set the foundation for the conversation we're having today.
Right, because as we all know, it takes a village to raise a child. And so it's important that we all get together and do this. So my next question, David, is how did the concept of parent survey experience, I'm sorry, how did the concept of parent experience survey emerge or rise?
That's another great question, Nicole. You know, we have many thought leaders in our network, and then we have various meetings and opportunities where they come together, especially around the Reach Out and Read networks and the parent experience. And we started wondering, people that we were in conversations with, beginning to wonder within our Reach Out and Read conversations about advancing early relational health, how gaining parent input. We started wondering about, you know, how do we measure it? Is there a simple tool, perhaps a survey or some clinical questionnaire that could be useful? The idea actually grew too with the influence of Pradeep Gidwani, Tyson Barker, Marianne Woodruff, Shayla Collins, my colleagues in Pediatrics Northwest and in Northwest of the country, and became clear that we needed to think about how we could gather direct information about the experience that families were having in the exam room. It became really clear that we either needed to find such a tool or we needed to develop our own. And the enthusiasm of that idea grew rapidly across networks. And that's kind of how this idea got generated and how it began to move forward. And Nicole, I think it'd be valuable to bring in Nikki Shearman here into this conversation because she really likewise saw the opportunity and the engagement in this work.
Yeah, definitely. I definitely agree. So Nikki, I'm going to ask you a question, which is I would like you to talk about the engagement of the Families Foundation of the Research 5, and then going forward with Nurture Connection was a commitment to engage parent engagement. I'm sorry.
Yeah, thank you, Nicole, and thank you, David. It's a pleasure to be here. Yes, we were traveling in a parallel universe for a little while. Reach Out and Read has always been very proud of the fact that we know that when Reach Out and Read is delivered, parents actually do change their behavior. They go home and they read more with their children. And yet we know that we weren't reaching everyone. And so we thought, well, okay, what is it that might improve our impact? And we decided to go out and ask the parents, you tell us, what is it that would make you more go home and read aloud and connect with your children? And when we did that in a special project that we did in Stanford University, along with the design students. Nicole, you were with us. You came with a set of parents where we worked together with the design students at Stanford University, and we were working on what was the optimal well-child visit for you. What would really make it the best thing? And it was very clear as you went through that process that the relationship with the clinician in that well-child visit was the most important thing that was going to affect what you did at home when you left the visit. And so we thought, okay, we need to start working on the relationship. At the same time, another of our colleagues, Dr. Manny Jimenez, who's at Rutgers in New Jersey, was doing a qualitative study, doing some focus groups with a range of families at his clinic, and asking the same sorts of questions. Do you want to be told about early relational health as part of your well-child visit? And what are the barriers that would stop you wanting to do something? And they heard loud and clear, yes, we do want to be told about this. But the most important thing is, if that's going to happen, we must have a good relationship in the exam room. So we came to that conclusion at the same time as David and his colleagues were coming to that conclusion. And we all decided together, let's take a look and start thinking about a survey. First thing we did was look to see, is there already a survey out there? We looked high and low. There aren't actually any surveys, interestingly, that have been designed specifically to ask parents about their experience or their relationship with the clinician in pediatric well-child visits. There are many surveys that have been used from different contexts that are used in pediatrics, but none that are designed specifically for that purpose. And so we decided, let's make our own. And so together with David and with David's colleagues, and then also we thought, okay, we're going to do this with the voice of the parents, because the parent concepts of what makes for a good relationship and their language is what's going to make this survey successful. So we made up a research team that included parent leaders, included researchers, included clinicians, included all those who were interested, and together we all started working on designing this survey. So it was a year-long process that we went through. Parent leaders were with us all the way and helping us design the questions, design the research, give feedback on the results. So we feel, I hope Desiree and Nicole, who were both involved in this process, agreed that they were fully involved and engaged in the process. Our parent leaders worked out empathy interview questions with us. Empathy interviews are an interview that you would have with someone that guides them through a conversation. And so our empathy interviews were where we asked parent leaders to ask their parents around them that they knew, what was their well-child visit like? How did it go? What made it good? What made it bad? To have an open conversation, to capture the results of that. We took the results of that and did a thematic analysis of the interviews. We then got feedback on identified questions. And again, parents were with us the whole way. We then went into a standard method that's used to refine a survey called the Delphi method. And the Delphi method brings in experts to help give it expert input into making a survey more concise and direct. And in this case, our parents were the experts. So we had groups of parents coming together. We're jumping back from the slides. I will just go to this slide because I think it's important. The parents that were included in the empathy interviews and that were asked by the parent leaders are represented here. We had them from different regions of the US, California, Florida, Pennsylvania, New Jersey, and New Mexico, and represented different races and ethnicities. And you can see here the percentage of what they were doing for employment. Some would stay at home, some were part-time, some employed and full-time. So we had a very diverse group of parents that we were talking to, all of whom had children in the 0 to 5 age group who experienced well-child visits and could tell us what it was like. And then if we do go to the next slide, and we're talking about that Delphi method with the parents, these parent leaders, they were asked the same questions several times. They were then given feedback between rounds, and then they would go in. So they would go in and say, we want those questions, we don't want those questions, and we're not sure about those. And then the next time we would go through that again. So we eventually brought 50 questions down to 13 questions, which made our final survey. And then the next slide shows the parent survey. So my child's doctor, I'll read through it, talked about my child's health in the way I understood, gave me the information needed to make the right decision for me and my child, gave me information on how to get in touch with them, addressed my questions and concerns, gave me full attention, did not seem rushed during the visit, worked with me in making decisions about my child's health, was kind and showed they cared, made a connection with me and my child, made me feel valued and respected, did not judge me, made me feel safe and comfortable. A final question, the doctor's office staff were respectful and professional. And you can see that there were 3 core themes that these covered: patient-centered communication, compassion and respect, comfort and safety. And we really believe that these questions capture the concepts and the language of the parents served in well-child visits that would enable them, if we ask them, they can answer these questions. They make sense to them. We then went ahead and validated this survey just to check that it was working. We managed to get 10,000 surveys from distributing the survey across a region of Reach Out and Read. And then we put it through a statistical analysis and showed that this survey is a good survey. It's asking the right questions. It's showing us what we need to know about how parents are experiencing their well-child visits. And we're very excited because we think that this survey will allow us now to go in and learn more about what are the things that do work, what are the things that don't work in a well-child visit that are going to make that relationship really good, and therefore make the families feel good and want to go home and read their books more together and engage with their families more, and as well do all the other things that are really important for their health and well-being.
Awesome, Nikki. Yes, it was bringing up to Stanford. It was definitely a challenging, but a good challenging experience. I think I ate like 5 Snickers on that trip. But it was a good experience, and you know, it was wonderful, you know, and also being a part of it too, because you brought parent voice into it, and it's amazing to have that. So I'm going to talk about the if I could bring Desiree into this now. Is that correct? Okay, so I'm going to bring Desiree into this because we were the parent leaders in this. And, you know, it was great because it was a new way of, you know, developing the research and the agenda and the points, and actually hearing the raw information. And, you know, and sometimes that's not always pleasant, you know, and it's an unpleasant, uncomfortable feeling, yes, but it's also a feeling that we need to be welcoming, because then we can actually hit the points of what needs to be worked on. So Desiree and I, we were both involved in the research design, and we conducted the empathy interviews with the other parent leaders. And we wanted to get the heart and soul of the process, because it's emotional, right? It's an emotional journey, and you know, like I said, it's uncomfortable, but it's a good uncomfortable feeling. And so we had conducted the interviews, and then we had this tool to impact the future and frame, and as back and forth, we actually had good back and forth conversations. And so what we're gonna do is we're gonna discuss our experience in it. And we had to use our living room language, and also just, you know, having that kitchen table talk or dining room sitting, talking with your relatives, going back and forth of what works and what doesn't work, right? And then also the role of how the language was important, because, you know, different neighborhoods, different environments don't always connect on those same words. So it's good that we were able to break that down and actually have a full conversation about this. So I'm gonna ask Desiree, and So I want to ask Desiree, and this is Desiree Small. She is a wonderful leader too, and also I wanted to ask her, what made you want to do this work?
I want to see parents' voice heard. I've been doing this for about 9 years, representing parents. So I wanted to also hear what they had to say because I have my own experiences. However, I was interested in hearing, you know, my fellow parents' experiences as well and see how they're impacted, and see what they enjoy. Did we have similar experiences? Did we have experiences that maybe that wasn't the same? And then bring me as a parent leader and even other aspects of my life, have a better understanding of what the community is experiencing.
Right. And it was so cool on how we were able to go and talk to our village, our neighbors, or not our
Yeah.
neighbors, but our, our community, and to be able to ask these questions personally. And it was actually a cool experience on just like reaching out to our community, and actually, they can feel that trust. They can feel that bond that we had developed with them. They were able to, you know, openly discuss the struggles and the positive parts of their pediatrician. So my next question is going to be and it's going to be a sensitive question. So
Okay.
why do you think parent voice isn't as valued in this work?
Um, to be frank, my experience, I go by my experience. I've had 4 children. My oldest is 14. My youngest is about to be 6. So, and then I have helped raise my siblings, as well, being the oldest of 5. And just the dynamic of a voice being heard in general when there is a lot of um systematic things that's going on anyway, it's always hard, it's always difficult for one side to hear the other. Okay. So I'll say that to lay the framework down. However, to build on it, I think I'm more optimistic about the future. Um, but the difficulties between one side or the other, if that makes sense, or the parents' voice being heard. Number one, we don't know. I believe as a Black woman in America, with Black children, we don't know how to articulate sometimes. And then the people don't know how to understand our language, like the doctors, and they don't understand. I really believe half of the time it's a language barrier, and it's also a cultural barrier as well. Um, we just have to, I always tell people this in any setting, from in a boardroom, you can't tell people what to do. You have to go into a town and be humble enough to hear what they need so that you can serve them correctly. So that method is not always um
Implemented?
executed
Yeah.
in the right way.
Mm-hmm.
And I think with researches like this and teams like this, we can really hear what they're saying, bring their voice to the spotlight. This is what they're saying.
Yeah.
So then we can adjust and make sure these families get what they need.
Right.
So
I
the
definitely
question
agree.
was like, oh, why don't you think? I think it's a whole bunch of stuff, but I do think with stuff like this, and researches like this and surveys like this, with me and you talking, just me
Mm-hmm.
and you talking, our voices is being heard. So
Right.
more stuff like this is very it's a more of a need of more platforms like this. So
Right.
if that makes sense.
Yeah, I definitely agree. And with your experience and with my experience for my Native American community, um, the atrocities of medical stuff is always not, you know, respected or even asked upon, like my grandmother, my tao had experienced, she had a whole hysterectomy and she was not told she had a hysterectomy, you know? And so, yeah, a lot of distrust has happened in my community as well, like the jargon, and they keep changing the systems after we are trying to learn their set systems, and it's constantly exhausting.
Yes.
But you know,
Yes.
we definitely, I agree, Desiree, we have to keep working together. We have to have hope. Otherwise, what's the whole point of this if we can't even keep moving forward and have hope in this? We can't just give up.
Yeah.
So then the next one I'm going to move on to is what the future plans are. And so now what, right?
Oh yeah. Now what? That's a good question, Nicole. Now what? You know, when you hear the parents and you hear what they have to say, what you gonna do?
Right. What do you, and
What are
it's
we going to do? How is our
right.
mind frame going to change after this?
Mm-hmm.
How are we going to posture ourselves after this? When you do hear, back in the day they used to have like, oh, put your comments and concerns in the box. Remember that? Like when you read the comments and concerns, what are we going to do?
Right.
I really like that question. I'm grateful to have a good pediatrician, but at one point I didn't have all the best experiences.
Right.
I was a young mom. I was married. I was a young mom. Either way, you know what I mean, married or not, I still needed
Right. Right. I was a
care
mom
for
at
my children.
17.
Right, like
Yeah,
care
right.
for my and then we have a new demographic where moms are having babies when they get older.
Mm-hmm.
How do you approach that? How do you approach it? You know what I mean? How do different generations connect?
Right.
Right? Like,
Besides
you know
off
what I
of
mean?
social media,
There we go. How do one generation connect to together? And I think it's really to love what you do. Love what you do. You know, like love what you do. We coming here, we need your help. If the child is sick, we need your help. He has asthma, my child had asthma, my child had this, I need your help. We're not
Right.
coming in to be cute.
Right.
We're
Well,
coming
not
in here
only
because we're coming, my hair probably all jacked up, was up all night with this
not
baby.
showered for
I
a week. That was me.
I need your help, right?
Right.
So, know that everybody is not coming with a smile, because it's not when you go to a hospital, it's not where this
Not
is not
always ponies and
right.
rainbows and
It
glitter. It's
normally it's
rough.
not. It
Yeah.
normally it's not. So
Right.
we have to make sure that, assess our attitude,
Right.
and then like meet them where they are.
Right.
Meet parents where they are in their level of understanding,
Mm-hmm.
and their level of comprehension,
Right.
and their level of even just being a parent.
Right. And not only that, give the
Just
space to
being a
ask those
parent,
questions.
because
Right.
I'll say this, everybody don't have like grandmoms.
Yep.
Everybody use my village, everybody don't have a big village.
Mm-hmm. We need to be the
Everybody
village
don't
together.
have a big village. So you're a part of it. So be privileged to be a part of it.
Mm-hmm.
And those 15, 20 minutes with the mom, with the dad, with the whoever, the
Grandma,
grandma, whoever
aunt.
is representing the parent,
Mm-hmm.
and then you can ensure that they'll never forget that, and know that. Like, it's some doctors, even when I was a kid, I'll never forget,
Right.
because the vulnerability, being present in a place of vulnerability, it's a lifelong memory.
Right.
So understand the position that we are all in.
Mm-hmm.
We're there when they're the most vulnerable. So we have to show up in their
Right.
vulnerability. Yeah. Parents and
Exactly.
children.
We have to show up and be present. Yep, exactly. Well, thank you, Desiree. Oh, that was so powerful. That was wonderful. So I'm
It's a
gonna
pleasure
move
to
it
be
on
here. Thank you.
to, yeah, I'm gonna move it on to Dani, and because she's our pediatrician. And so I'm gonna move it to Dani and her point and how she would imagine this would be used. How do you see it being helpful and in the clinical spaces?
Yeah, thank you for having me on. I think the important thing to realize as a practicing pediatrician is that I had absolutely no training in anything relational, right? In my own training. And I'm not that far off. So, you know, I trained only a few years ago. Um, and that's an important, you know, point that we can't just expect pediatricians to pick this up on their own. This is, you know, this is like every other skill that we learn in medicine, something that we need to generate the right tools to actually teach physicians. And you know, we're talking about pediatricians specifically today, but really this is important to do across the board in medicine, I think. And so that's, you know, that's the most important place I can start, which is that there just isn't this education right now. Now, my own personal interest, of course, is in early relational health. So what happens between you know, the parent and the child, and how those bonds form, and how we can support and promote them. But you know, if we're talking about ultimately being able to improve that bond, the bond between parent and child, then, you know, I do think that we need to think of the other relationships in the room. And I think that what this group found, and this really cutting edge research found, was that indeed that's what the parents were telling us, that you know, if we want to be able to help them in their relationship, we have to first improve the relationship between the parent and the doctor. So I really think that this is an important uh, contribution to the field. You know, you asked, I think, you know, how do I envision this being used? And I think that this, you know, ultimately could become something that all offices, all offices that deal with pediatric primary care, so that doesn't necessarily just mean pediatrics, but family medicine, for example, as well, can use this to both as a benchmark to kind of measure themselves, like where are we at right now, but also ultimately to put practices in place that promote the continued education of how to improve that relationship.
That's awesome. Even hearing that from you, a pediatrician, you know, hearing that that was a skill you needed to develop. And I love the vulnerability. I think one time too, when you had spoke about how it made you feel uncomfortable, and you're this pediatrician who had openly, vulnerably said that. I love that, because it's like, she's human and I'm human, and you know, to openly ask these questions is just, that's just amazing. I just want to say that. Thank you, Dani. So I'm gonna ask Nikki now, which is Nikki, of the tool you discovered, how do you imagine the tools being used?
Yes, start my video, sorry. There we are, I wasn't quite ready. We're very excited about the use of this tool. As you know, Nicole, we've already started looking at a way of incorporating it into different ways of testing methodology that might improve the patient relationship with their clinician. So it's called a QI project. It's something that clinics often do. They'll test out a new way of doing something and then measure if it's improving that. So we can use our survey, we can give it to clinics, and then they might say, right, we're going to try, one thing that they're trying is how they might welcome a parent into the room. And they'll try that out, and they'll measure using our survey, did that make a difference? Did that make them feel more welcoming? And so we're just starting to pilot that work and test out some different ways of doing it. But we're hoping to spread that throughout the Reach Out and Read network. We have a large network of clinics that we work with, so that we can transform pediatric care so that it focuses more on the parent relationship and with the clinician throughout the network. Another use for it is that we can use it to measure, for example, Reach Out and Read and its impact. So we were very excited in the validation. It wasn't an expected finding, but we crosswalked the survey, the results of the survey, with the results of Reach Out and Read quality of clinics, how they deliver Reach Out and Read. And what we found was that clinics that deliver Reach Out and Read with high quality, the way it's meant to be done, the parents from those clinics were 46% more likely to say that they had an excellent relationship with their clinician than parents from other clinics. So that's a very strong indication that even just delivering Reach Out and Read affects the parent-clinician relationship, which we kind of had been told anecdotally, but now we have research for it. So we're now using that survey to kind of find out, well, what is it that makes the difference? What is it about Reach Out and Read or any other program that affects the relationship? So hopefully using this survey, we can start improving that relationship in the exam room throughout the nation.
That's awesome. That is awesome. And so I'm going to move on to David now, which is for the impacts of nurture connection. What do you hope happens as a result of this tool that Nikki is talking about?
Hasn't it been amazing to listen to this? Not only the parent participation in the development of the tool and its meaningfulness to really have the clinical experience be meaningful for families. So from my standpoint, we're really bringing the heart and soul of the parent experience into clinical spaces in such a way that we're actually generating a new paradigm of the doctor-patient family relationship, ever more about meaningful transformations and the importance of that accountability to families that we can collectively work together. That opportunity, I think, is spreading like wildfire as a field really discovering the importance of that journey as we begun to even consider how this approach becomes meaningful for other sectors that touch and participate with families, be that home visiting, be that community health workers, be that doulas and others, where the relationship is the driver of well-being and of trust. And families know in an instant the mindset or the belief that a caregiver has about them. They can sense. And we as providers are beholden to know how those we work with experience us. It's in that parallel process of relational health, that sense of meaningful relationships that are trusted, that we as any level of providers have a clear accountability by a tool that can help us know. We think that's transformational to what a relational health focused community of multiple actors and supporters partnering all with families can learn together. So I'm really thrilled, and I think it's just the beginning of what can be really re-inspiring. The support networks of trust and supports where families feel a real sense of, the beauty of the relationships, of that committed effort to the well-being that sits within so many of our sectors that love that role with families themselves. So those are my first thoughts.
Yeah, I definitely agree with that, David, because I remember when I experienced my postpartum depression, I didn't have any support by anybody, and I had a home visitor during that time, and she was the one who was just like, and I experienced it with my fifth baby, so everybody was just like, well, this is your fifth baby, you should already know, but this one hit me hard. So anyways, my caregiver, my home visitor was just like, Nicole, you're fine, you're doing okay, there's no poop on the floor, your kids are clothed, I know you're looking crazy, but you're fine. So even like you said, that relationship, if I didn't have that, I was losing my mind. I felt like I was losing everything, but she's like, no, you're doing fine. You're doing what you're supposed to do. And just even that level of comfort helped me keep going. And because of that is why I'm so passionate about this work. And I'm so grateful to have everybody on here who's part of this. It's amazing that, that there's people in this work that want to keep it going.
And Nicole, do we want to ask Nikki and Dani and
Yeah.
Desiree what their hopes are
Yeah,
for
definitely.
what's emergent? I'm just curious our other colleagues' voices.
I'm happy to pitch in. I do see this work coming really beautifully together with one of our efforts that Nikki and I are also working together on, and Nicole is helping us lead a portion of, which is to now start to focus on the relationship between the parent and child, but also from the perspective of parent voices. So we were conducting new interviews with families, and Nicole, you were one of our parent leaders conducting those interviews to hear how the parents are talking about those connections with their children. And this is, of course, a continuation and really was inspired by Nikki's work when we started working together to think outside of the box in terms of relational health. So far, all the things that we kind of have in the literature in terms of attachment and maternal sensitivity are all sort of researcher-based or developed concepts, and they haven't received that experiential parent voice that we are now seeking to bring into this work. And I do think that we're going to be finding very common themes. I think connection, is there's something universal about connection. It's not uniform in Lee's words. It's universal but not uniform. And I think that there will be something fundamentally similar across different types of connection, and that's why doing this work in a relational framework where you think about all the different relationships, I think is really powerful.
Mm. And I can add on to that. It's just the experience of doing the work with parents is such a pleasure. This whole year where we've worked together with you, Nicole, with Desiree, and with our other parent leaders, it just is a wonderful way of doing the work. It brings in different ways of thinking about things that are refreshing. There's a question in the Q&A saying, I'd love to hear an example of how the questions changed because of the engagement of parent leaders. It's difficult to know how they changed really because we didn't have something to work from. And yet, if you look at other surveys that are out there, the language is more stilted, more formal, and there's less warmth in those questions. So the questions that we worked on with you, because of what you brought, just made them warmer and more relational, and they work better, therefore. So it's just a pleasure to be doing the work, and I hope we'll have, with Dani, plenty of other opportunities to keep working with you in the research setting. It's kind of groundbreaking what we're doing, and I love it, and I hope that it spreads.
Nikki, would it be fair to say that it's really bringing the humanity into all of our work together and this deepest sense of respect and belonging that we deeply care about?
Yeah, I think so. Somehow when the meetings are there and we're all talking about this and the parent voice is coming in, they're better meetings somehow. I think it's because we have all the players in the room, it changes the atmosphere. And I think that's what we need to be able to do this work, which is in itself relational.
And if I can add just another sort of big picture philosophical point here, the last 100 years, medicine has really focused on curing disease, and we've just had some absolutely tremendous results as a function of that, right? Like children no longer die from leukemia nowadays. That didn't happen perhaps when you were training, David. Um, and that's been groundbreaking in terms of what's done to our ability to cure very complicated diseases. But unfortunately, the sort of human side of medicine has gone a little bit down, right? Like if we think about medicine for thousands of years before about 100 years ago, all the healing was really just relational healing. I mean, almost entirely, right? Like they didn't have the actual medicines to cure disease, and yet they did do healing. And so this work for me is really meaningful because it's bringing that back around, right? Like okay, we've had the 100 years of progress in terms of really deep scientific knowledge of medicine, of mechanisms of disease, and now we're sort of bringing back that human aspect into medicine.
A promotion of the relational health sense, that humanity within that healing opportunity of hope that sits in some of those experiences in and of itself has power and meaning. and influence to well-being, to flourishing, future, and those journeys that recapturing that humanity into all of our healing arts becomes really important.
I would just say, I really want to hear what the parents have to say, you know? I really want to hear what the parents have to say, and I really want to, for the future, to continue to hear as medicine, as technology evolved, how it impacts the family, right? I really want to hear what they have to say. And then also bring it to you guys, and you guys make the next steps, because the doctors, the physicians, the pediatricians, and Nicole talked about postpartum depression, all that intertwines. We're all in this together. We're all in this together. And I would love to see a greater and bigger partnership with community and the people who serve it. I would love to see it. We all in like the uniting force, so then our children can flourish. So when my daughter becomes a mom, there will be better things that it would be a better system to where it would just be a better atmosphere, and we can learn from this and keep building. That's what I want to say.
Definitely. I definitely agree. And in this climate, I think we have learned to tear each other apart, rip communities and villages apart. And I think it's important that we cannot allow that to keep going, that we need to keep the love and the hope alive. And, as Bob Marley says, light up the darkness.
Love it, Nicole. No.
So I want to also talk about with Dani, which is before we move on to the audience questions. I know that Dani has a webinar coming up this fall. I think it's on Thursday, October 9th. Can you tell us a bit more about that?
Sure. So I guess I already started previewing our interviews that I was talking about. They are currently ongoing. So parent leaders, including Nicole, are currently, and I believe Desiree as well, are doing these actual interviews with a few parents in their communities. This was a really beautiful process of co-design, very similar to the co-design of the parent-clinician survey, where the full interview guide was designed in complete partnership over several months with parent leaders. We tore apart all the questions. We thought deeply about what they were trying to get at. We thought deeply about whether or not they were culturally both accessible, but also, honored the cultures of individual parents. We have just started getting some of these back. They are transcripts that are completely de-identified to us, and we're starting to dig into it to see, how do parents talk about their relationship? This work wasn't necessarily designed in order to generate a survey, although it might at the end of it do so. We really just wanted to take a step back and just listen to parents in terms of how they talk about that connection. And so on October 9th, we will give the first sneak peek at the data. It won't be complete by any means. It won't be as nice and wrapped up as what Nikki presented, but we will be able to present just the first initial findings.
It was
Yes.
very exciting. And Nicole, I wonder if we should start asking the audience to ask us questions, bring forward reflections, and the like. We've already had a few questions that have come in the Q&A sector. One is, can the survey be used in non-medical setting, like for social workers, family workers? I would add perhaps home visiting. And Nikki, I'll turn to you, but my first answer is, let's explore it together. Let's see what we can learn. Nikki, what would you say?
David, I'm so sorry. I was reading one of the questions.
Oh,
I missed what you asked. Can you ask that again?
the question was, can the survey be used in non-medical settings?
Yes,
For social
yes.
workers, family workers alike. And my response is, well, let's explore it together. Let's find out.
I think that's absolutely right. We are going to make this freely available to anybody who wants to use it. And we'd love to learn what you learn. We're calling it the Connect survey. And we're going to trademark it, and we're going to put it up on Creative Commons under Reach Out and Read, but it's freely available. It's very early days yet. So again, happy to share it with anyone. You can just email me and I'll share it out. We will ultimately be putting it up on our website in the next few weeks so that you can access it there. We're going to be moving forwards with looking at some of the questions. Our validation showed us that there's a little bit of redundancy in our surveys. Their questions are asking the same sorts of things. So that we could make it even shorter. There's also, what we're learning is the biggest differential in results comes out from questions that talk about the connection. So my doctor connected with me and my baby is the question that has the widest range of results that might really be telling us something. So we're going to dig into that a little bit more and learn from parents. Well, what do you mean when you say that? What did the doctor do or the nurse practitioner do that made you think that they were connecting with you, so that we can learn more about that? So we're going straight ahead, learning more about the survey. If you can take the survey, use it, learn something from it, brilliant. Do that, and then please let us know. If you make any changes, let us know, so that we can keep this survey going. I can also answer the question that I was reading when you asked me that question. Is it available in other languages? We only have it available at the moment in Spanish and in English. The validation has been done in English. We have the data from the Spanish. It came in a little bit later, so we haven't finished the validation for that yet, but we should have the validation for it in Spanish. And so we've got those two. But yes, I mean, once we have this survey really working well, we will translate it into other languages so that it's accessible for all families.
There's a comment and a question in the Q&A from a pediatric nurse practitioner, delightful, and asking about family-centered care and saying the terrific parent survey you've created seems nicely aligned with components and related metrics of family-centered care. Can you speak to how you see the overlap and differences? I'm not saying I can see differences, but I can say that what we believe is really valuable about this tool is it's been solely parent built and adjusted and modified and been generated by the Delphi method of parents themselves as to what's most meaningful and important. Before then, it was brought into this clinical space. So it's all, of course, certainly aligned with family-centered care. We would say that it's ever more an authentic tool built by the experience and the desires of families for, in fact, their family-centered care hopes and desires.
Okay, so the next question is for Desiree. Do parents want guidance about how technology can affect relationships within the family, can interfere with healthy attachment if the child or parent is very distracted by tech? Ooh, that's a good one.
Can you just speak up a little bit, Nicole, so I can get the whole thing?
Can you guys hear me now?
That's a lot better.
Cool.
Go ahead.
So it says, can it interfere with healthy attachment if the child or parent is very distracted by tech? What clinicians use of technology during patient visit that may get in the way of the doctor-parent relationship?
Nicole, I love you. You gotta slow it down. Baby, I'm like, huh? Say it one more again. So one more again for me.
Okay, so it says, do parents want guidance about how technology can affect relationships within the family? I'll let you answer that first part, and then we'll go to
there we go. I was going to say, let's break it up a little bit. I think parents I'm just talking about, we didn't ask that specific question. However, in my findings of just being a parent and, talking to my neighbors, I would say this. It's not more of the technology because, the millenniums, they're growing their 30s. We've been having internet for most of our lives. So I think maybe the initial transition to all the apps, and that's sometimes a capacity thing because of phones and devices. And then sometimes it can be tedious. But I think that once I know, like some of my friends, once we get involved with the apps and technology, it's more easier than calling the doctor, and you could do everything on your phone. So did that answer the question? I'm sorry.
I think, well, I guess the major one is, can it interfere with the healthy attachment if the child or parent is very distracted by tech?
By tech? That's a really good question.
Yeah, it is.
Now, I have 4 children. Some, a couple of my kids, they love the internet. They love, their games. Can it be, in my personal opinion, because that's not a question that we asked in the survey, so I'll just give you a little synopsis. It's really up to the parent. You have to take initiative as a parent to bring a stable balance of outside play, on a game, on their computer, on their phone. As a parent, you want to guide that in the best way you know how to. I would say get information from your doctor, get information from local organizations to see how you can do that. But I'll just wrap it up. Make sure you are, as a parent, guiding that along the way. And it's different for different ages. And when you're around your child, you know what their strengths and their weaknesses are. And I will say this, I give this to parents. Get involved with what your kids like.
Yep.
If they like, get a game, get them on control and do it with them. You'll be surprised how the compatibility and that relationship will bind because you're in their world. So then when you ask them to do something, or you instruct them or redirect, they say earlier, redirect them into reading a book or doing something more, not even more, just doing something else, you'll see the results that they're easy to pivot to other things. So that's all. Is there anything else with the question?
No, I agree. Instead of just ripping it clean from them, and then you have a crazy gremlin on your hands, right? So,
oh no, you don't do that in my house. But I get what you're saying, because every family is different, and every child is different. They have different disabilities. But I would say, go in with them. You might not like their songs, because I ain't like my mama's songs neither. But act like, show up and be like, yeah, I like that too. You might not love it, but it's something, get in their world. Get in their world. I think that's really important.
Bringing them back to being grounded. Okay, so let me ask the last part of that question.
Okay.
Hold on. I lost it. Oh no, what happened to?
It's all good.
Is it gone?
That's all right. We can come back.
I was like, I don't see it anymore.
All right. Our dear friend Annie Garner, both visionary, pediatric exemplar leader of early relational health and living it in practice, and inspired all of us, makes a comment and asks a question, and this is really important. Connections and relationships are not static events frozen in time. Connections and relationships are dynamic. They're waxing and they're waning over time. Hence, they demand empathy, humility, and concepts and beliefs in repair. How do we elevate the importance of repair in a culture that disregards empathy and humility? First of all, I think my view is, we model it, we believe in it, we state it, we live it, and we partner with all people we have with that mindset. So I think it's how we are present with all people that we're with, not the least of which is the young families who we work with. Nikki, to you.
Yeah, and I think thinking about that there is a kind of a dynamism around relationships, and taking that then into the exam room and recognizing that, yeah, you're not always going to have the connection that you're looking for with your clinician. But maybe if we recognize that, and that's something that we bring into pediatric care, that there's a recognition of this, and what are the things that we can do to repair those relationships, and then we can include training about how to do that, or instruction, information about how to do that, and then test if we use those methodologies to do the repair, does that help create a better relationship? And therefore that takes that, we can learn from the survey, using the survey, does that improve the relationship all told?
There's an amazing additional comment from Barbara. And she says, I'm a birth to 3 provider in Connecticut. Desiree, your comment about language barriers gave me pause. Would you mind expanding on that? I thought about that from the parent perspective, what they are sharing, asking, needing, and the provider perspective, responsiveness, clinical language. Could you expand on that? Help me understand better what you're thinking about that combination of conversational space.
Well, that's a thank you for asking that question. And I appreciate that. I can expand on that. I would say this. I've worked along with Spanish-speaking families, Haitian families, different cultures. And I'm a Black woman, you can see. However, the barriers could be if they don't speak your language or you don't speak theirs, that's a barrier right there. They are here, they don't understand what you're saying, they don't understand exactly what you're saying. That's a barrier. I know Mr. David and Nicole was talking about kitchen talk. The kitchen talk, I would say it's more being comfortable with the language where we're not so professionally, using our words in such of a way, I always call it like boardroom talk. So that's a language barrier as well. Everybody doesn't know how to code switch where they can talk in this format or this kind of setting, and then everybody don't know how to do that, and everybody don't know how to advocate for themselves or for their child in a way where they change up their language for you to understand. So I feel like the language barrier from a parent perspective or parent leader perspective, because there are different things, is that when I'm talking to the parents, they're telling me, this is them. Well, girl, for real, can I be honest with you? You know what I mean? They're not sugarcoating anything. They're telling me exactly what happened, even the little details that they might not express to you. You see what I'm saying? So that could be another language barrier. Also, slang. You know what I mean? Like, the accent from slang. Philly and Baltimore, down south, my husband from South Carolina, down south, they're totally different ways of talking. And you get more comfortable, you're more comfortable when you're with your family. You're more comfortable with people who run away, or they say around here, run away, or so that could be a language barrier as well. I would say, if I'm not from down south, they don't want that neither. They don't want you to pretend like you from where I'm from. You see what I'm saying? But the compassion, I did one of these things. In the morning, the parents will come in, and I knew my Spanish-speaking parents will come out, but hola, just to show them appreciation, that I appreciate them in their language. And then when the Haitian families will come in, I'll be like, bonjour, like, you know what I mean? Like that kind of, those little things that you can do will dissolve that barrier. And it works for different things, work for everybody, but just get more. My husband would say, find a common ground and do what you can. They appreciate. I appreciate when physicians do what they can. You know what I mean? It's not, we're not expecting you to, have gold chains, and we understand you might not be from where we are, but we want you to understand. We want you to not dismiss who we are. So that could be a language barrier as well. Sorry to be so long-winded, but yeah.
Oh, beautiful. Dani, there was a question about grandparents and research and your thoughts. Could you lean in on that idea?
What was the exact question?
Well, we can look. It was about grandparents are primary caregivers sometimes, and what are you learning about even in your video-based work within Combo, and how you're thinking about the learning in the grandparent space of caregiving?
Sure. So unfortunately, so far in the combo cohort, we really have not been able to involve grandparents. So that is a limitation of our work. But as we're expanding into the combo national phase, which we're actually just starting to pilot, so there is a pilot ongoing of recruitment through the Reach on a Read network in 6 different sites that we just started in April of this year. And we're recruiting from clinics. We're recruiting families with babies less than 2 months old. And in particular, we're enrolling the primary caregiver, whoever that might be. But we're also asking that primary caregiver to involve as many as up to an additional 4 other caregivers of that child to try to really get a sense for all the relational sphere of each of these children. We're just in the pilot phase, so we're just trying to see if it's feasible and we can recruit these additional caregivers. But hopefully, we'll have some grandparent data at some point in combo. I will just mention really briefly that there was a really beautiful study maybe about a year ago that showed that having grandparents living with the family, so habitating and helping with the childcare was really good for child socio-emotional development. So I mean, not that it's a surprise for us, but generating this kind of data and having that hard evidence is really important for policy making. And so having that was one of the most beautiful pieces that I've seen about relational health.
Phenomenal. We could go on for a while. Yet I'm thinking, Nicole, we should begin to sort of finish up. How do you think we should go about that? Thoughts?
Finishing up the webinar or
Yes, I think
finishing?
it's getting to be time.
Oh, right. Well, I think we just would have our closing remarks of this webinar, and I appreciate everybody attending. Thank you for showing up, and that's what matters, right? We're showing up and hearing out different perspectives, even if it's one you're not used to, even if it's not a clinical setting. I think that makes me wonder too about what's the difference between a clinical setting and a living room language, right? Like when we're asking the questions, when we're asking in the doctor's office, and when we're asking at home. So I think that's going to be another one. I think that we just need to keep our village together. And if, especially what Desiree had said, hearing from other different families, they don't have their villages, they don't have their support systems. And so what we need to do is start stepping up and just showing up. Even if we don't know the exact tools, just showing up is important. And I don't know if Desiree, if you want to say any closing remarks.
Say one more time, Nicole.
If you want to say anything in the closing remarks of the
Thank
webinar.
you guys for showing. Yeah, I'm sorry. Thank you guys for showing up. Thank you for allowing my voice to be heard. I really appreciate that. I don't take it lightly or take it for granted. Everyone here on the team, all the other parents that was involved, just shout them out. I'll shout them out formally, you know what I mean, or informally. They all did a great. I love hearing their perspective as well, and just thank you for allowing me to speak with you guys and give my perspective. It's appreciated. Thank you.
Right. And I just want to say thank you, David, Dani, and Nikki. And, thank you for allowing us to join on and speak, because we didn't have a degree. You guys asked us in our personal experience, and that was great just to even be a part of this. So thank you.
Well, thanks for all of you for attending and join us as not only join our network as was presented forward, but keep a good eye as other webinars will come down the way, where we always feature parent partnership in all things we do. And it's been delightful to be together and take what you've heard today, spread the word. test the tool itself if you so desire, and give us feedback as this larger learning agenda that we've all built collectively is advancing a relational health frame with the dignity, respect, and humanity of all people that we touch. So thanks all.
Do we just stay quiet or do we all jump off too?